I can tell you that we were notified in that meeting that we do have one confirmed case in Madison County at this point. We don't really have any more details on that. We're in contact with ADPH while they're investigating that, and we will certainly get you that information as we receive it. We continue to monitor the situation daily, and we are implementing our emergency plans as we speak. We've been doing that for the last several weeks. We're constantly having our meetings and our conversations on whatever the situation is and what we may need to do moving forward. With that being said, I'll turn it over to Mr. Spillers from Huntsville Hospital.
Yes, thank you. Yes, thank you. I remind everybody to continue to sanitize and separate. And probably the most important thing you'll hear from me today. As mentioned, we did have one confirmed case here in Madison County. That case was in one of our emergency departments, and I can't tell you which one right now. The patient is home self-quarantined. It was not an inpatient. We continue to wait on testing for several patients, probably 20 some odd patients that are in our facilities that had that were waiting test results from the state. I should also remind everyone that the flu virus is still very prevalent. Symptoms are very similar. Many people that we are testing have the flu. They do not have coronavirus, but they're in a panic because they think they do. So that's out there. Be aware of that. I had mentioned yesterday that we were looking at a drive-up testing facility. At this time, that is going to be put on hold. We're asking the state to help us with some criteria as to who would be tested. I think in some of these sites that have popped up around the state, individuals are going to be tested when they have no symptoms. They're not designed for that. They're designed for people who have been referred from a physician who actually may have that have a need to be tested. Individuals who have no symptoms, no need, and have not been around anybody who have had the virus are only wasting test kits if they go get tested. So we need criteria. The other thing we need is test kits. I think a little bit of we're having an issue with lab vendors' ability to consistently supply test kits, and I think some criteria on what I just mentioned would help with that. Once we have those in place, we'll look at establishing one or two sites in town where people can easily get a test done after they've been seen by a physician or a nurse practitioner, and it's determined that they actually need a test. We are planning to open up another urgent care center. We'll make that announcement probably tomorrow. That'll be close to our Huntsville Hospital main facility. It's going to be specifically for people who have respiratory and flu symptoms. Again, concerned that that'll be just inundated with people who are curious. We really need some criteria. People need to be sick or feel sick and have some symptoms to come to that. It'll be staffed by nurses and physicians. It will be a place to diagnose. We will try to get testing on people if they actually meet the criteria to get testing for coronavirus. Other than that, we're having daily calls among our facilities across North Alabama. Keep in mind we've got facilities all across North Alabama. We're looking at available beds. We're looking at available ventilators. We're trying to plan for the worst while we pray for the best. We will move resources among our facilities as needed across North Alabama to wherever there's the most significant need. We're looking at plans to move patients from Huntsville, Maine to the outlying hospitals to create capacity in Huntsville, Maine if needed, because that's where the most critically ill need to be during this time. I will tell you that our hospitals are very busy right now. As I mentioned, the flu's still out there, the respiratory issues out there not related to this, and other medical problems didn't stop just because the virus is now prevalent. So doing a daily bed count to make sure we've got a good allocation of our beds. So far, everybody's doing well in our system. Our staff is doing unbelievably well. No one's panicking, and I would urge the community not to panic. We're managing this reasonably well. We'll continue to manage it as a community. I'm very impressed with the way the community's come together. We won't be perfect. Somewhere along the way, we'll make a mistake, but we'll recover from that. We're all charting some unknown territory here, and I hope the community will bear with us as we work our way through this. Please comply with the requests from our elected officials on meetings and separating from people and sanitizing. That's still the best thing we can do to keep this from spreading, is to keep our distance and keep our hands clean and move forward. With that, I'll turn it over to the next speaker.
On HAMC's behalf, we have responded to about 20 events so far this week where patients presented with symptoms and were probably suspicious for what could have been coronavirus. Our people have responded with their appropriate CDC recommended personal protective equipment, and all those folks have been transported without incident. We are experiencing really no more significant call volume than normal. These calls that we've had, as David Spiller said, there is a significant amount of flu in our community and respiratory illness. So our call volume is already high, and we had already added additional units to our schedules to help accommodate that volume, and we are maintaining those additional units. And I feel very comfortable that our staffing levels are well prepared to help us deal with whatever we're presented with in the coming days, and we have the option to increase that staffing level higher if needed. But right now, our staff also is quite resilient and is doing a great job, as are all the first responders. Some of our first responder agencies have elected, and I think wisely so, to not respond to very low acuity calls, meaning people that are presenting with really no life-threatening signs or symptoms, to help minimize their exposure, and we endorse that. So we are continuing to respond, and we'll continue to do so. We have experienced a little bit of some panic calls early on in this incident, and we just ask that the public continue to reserve calling 911 and EMS for the most critical situations and real life threats. But if you feel like there is an emergency, don't hesitate to call.